Welcome, everyone. My name is Mariana. I'm a part of Sea Turtle Rescue Alliance. I'm a veterinarian. And today I'm actually joined by a colleague of mine, Dr. Minnie Liddell, which most of you know her as Dr. Minnie. Welcome, Minnie.
Hi, Mariana. Nice to see you again.
Nice to see you. So today you're actually not here as part of Sea Turtle Rescue Alliance, but as a part of a second organization that we actually would like to introduce to you, because this is introducing our affiliated rescue centers. So would you like to let us know who you are, what rescue center are you representing today, and what its name, basically, what's your job or your role in it?
Yeah, sure. So yeah, I'm Minnie. I'm a sea turtle veterinarian who I work for the Olive Ridley Project. So we are a UK-based charity. We run a rescue and rehabilitation centre in the Maldives, and also lots of different research projects at different parts of the Indian Ocean. So, but yeah, I run the sort of rescue centre here on the ground, caring for predominantly sea turtles that have been entangled in fish nets.
Okay. Any particular area within the Maldives, or do you help everywhere within the country?
So we are located in Atoll, which is kind of about 140 kilometers from the capital city, on the sort of east side of the Maldives, west side. And we do take turtles from all up and down the country though. So we are pretty remote, like we're on a very small island, about 600 meters long. That's where our rescue center is based and our veterinary clinic is based. But we can take turtles from all up and down the country. So we have, we can transfer them via things like seaplane or speedboats to get them here on site to provide them veterinary care.
It's quite an overtaking, taking like all the seaplanes. So how long has your center been operating? How long has that one in particular been working for?
So the Olive Ridley Project has had this rescue centre now for just over 5 years. We've had our 5th anniversary in February, and we are based on a resort. So we're in partnership with the resort. So we have the clinic on site, the rescue centre, and the veterinary clinic, and we've gradually built that up now to a point where we have a really well-equipped centre. And yeah, we are sort of just getting very established, I think, which is nice. But yeah, 5 years now.
Okay, that's nice. And what kind of species of sea turtles do you get to work with?
So we predominantly do only work, well, I say that 80% of our caseload is the Olive Ridley sea turtle. And then the rest of our caseload is made up predominantly of hawksbills and greens, but we are very much, the Olive Ridley Project in that sense. When it comes to the rescue and rehab, we work as a charity very holistically in all different aspects of sea turtle conservation. But when it comes to the rescue rehab, it really is predominantly Olive Ridley's.
Okay. Yeah, that's not very common to, in other parts of the world to see Olive Ridley. So that's quite a particular aspect of your rescue center. It's quite interesting. And what capacity does your rescue center, or like how many turtles can you actually take per year or at one given time?
We can take, generally we take between 8 to 10. When we get to our very busy season, we do have a particular peak which coincides with the northeast monsoon in this part of the world. So we end up seeing a lot more entangled turtles during this time, which can sometimes push our patient upload up to about 12 max. But anything beyond that, we would be struggling purely for physical space. So yeah, but ideally between 8 to 10.
What is that time of the year that you're more busy? I mean, what months?
It's between December and March generally. So that's when we have the currents pretty much reverse here. Like the Maldives is kind of in a particular area where we have lots of different currents converging on us at different times of the year. So during December to March, we have the northeast monsoon. The currents coming east to west, and that brings a lot more of the ghost nets. So we mainly see sea turtles entangled in ghost nets, in discarded fishing gear, and that physically brings it into the Maldives in a lot higher frequency than the rest of the year. So we see these guys literally wash in much higher numbers during that period of time compared to the rest of the year when the currents are the other direction. Yeah,
I was going to ask you afterwards what would the common injuries that you do get to see there, but I'm guessing apart from entanglement, which apparently is quite high on that list, what other injuries or illnesses that you can face with the species there?
Yeah, we see again sort of roughly 80% of our patient intake is also ghost gear entanglement. So we to that end we see a lot of associated issues around that. So severe flipper injuries, exposed bones, a lot of fractures, and then things also come with that, like chronic kind of debilitation to a degree, like emaciation, pneumonia, immunosuppression, and all the sort of osteomyelitis, lots of things that come with these turtles potentially having been stuck in one place for a really long time. We think months in some cases. But then outside of that, we also see see things like boat strikes, not super common compared to the other sort of issues, but boat strikes, fish hook ingestion, and then sometimes we have quite a few who are just randomly found floating. But in many cases, we do still assume and can see some evidence that they've been entangled. So it most likely has come about as a result of previous entanglement.
And do you notice any, I don't know if just out of curiosity, do you notice any particular type of illness or injury regarding a specific type of species out of their behavior, or not really?
Yeah, I suppose for the Olive Ridley turtle, the reason we see so many Olive Ridleys, it's interesting to note that Olive Ridleys actually don't come from the Maldives. So they're not considered part of the Maldivian flora and fauna. They're not foraging here, they're not nesting here, and they're only very sporadically seen in and around the Maldives. So they only actually come into the Maldives in the fish nets, entangled in ghost gear. So we see really exclusively these guys are ghost gear, and then the hawksbills and the greens that we see tend to be other issues. So we sometimes see sort of what we assume to be toxicity. We have some hawksbills that we find sort of just floating, good body condition, good weight, looking otherwise normal, but very, very weak and debilitated. So we do see that. And then, yeah, things like boat strikes and stuff like that. But most of it, yeah, the Olive Ridleys are quite specific in terms of their, like the etiology of their injuries. And also they're quite specific in terms of the things we see. We see a lot of buoyancy problems, specifically in Olive Ridleys, where we don't see them as often in greens and hawksbills, even if they have had the same issue. So entangled Olive Ridleys seem, from what we've seen, much more likely to develop buoyancy problems compared to a green or a hawksbill who also gets entangled. They seem to regain or retain their buoyancy without an issue, but the Olive Ridleys are very sensitive.
Wow, that could be quite interesting to look at the data that you've been collecting over these years and actually be able to fully check that out. That would be really interesting. So obviously we know that you are a veterinarian, so that's your role in there. But so it's kind of pointless for me to ask what's the situation with your veterinary care, but what do you actually can perform there? What kind of facilities do you have access to? And, you know, what do you wish that you had more in the future so that we can try to get some equipment to you?
Sure. Yeah. Well, I guess we're really lucky that, like, when we started, when Olive Ridley Project started here, we were the only vet in the whole country. So we've had, ever since we've opened this rescue and rehab centre, we've had a full-time veterinarian on site. So I've been here now for the last 18 months, and over those, over the 5 years that we've been in operation, we have acquired a lot of equipment actually. So we have digital X-rays on site. We have obviously microscopy. We have a sort of full surgical facilities. We've got an ultrasound, and we also recently acquired an endoscope as well. So we're getting really well equipped and really very fortunate to be able to do quite a lot of stuff for our patients on site. We don't have to go anywhere. We used to have to go to the human hospital to use their X-rays when we first started. So we had to collaborate with local human hospitals on local islands. But luckily we're in a position to travel
a different
island.
island.
We used to have to put the turtle on a boat, take it across to the local inhabited island, put it on, use their X-ray facilities, and then come back. So it was certainly not straightforward. I'm very glad I never had to do that. I have been lucky to have all the equipment since I've been established here. So yeah, but we can really do most things now.
Such a remote island to have access to so many equipment already. That's quite impressive. Yeah, that's great.
Yeah,
have you been able to use already that endoscope?
I have. So yeah, endoscopy is not something I've used a huge amount of in my previous jobs. So yes, I've been using and been sort of practicing and coming to terms with how to do it best. And we're lucky as well. We have a visiting veterinarian program, so we run a sort of alongside the work we do. We like to invite vets over from around the world who have specific skills, in the hope that they can obviously continue our professional development as well on site, as we are obviously on our own. That the vet on site is on their own and fairly remote. So inviting people over to teach us things that we may not otherwise have the chance to learn. So at the moment, I now have a vet who's going to help me get more established with the endoscope. So she's a very comfortable endoscopy user. So hopefully I'll also be able to develop my skills a bit more in that.
Oh, that'd be great. It's quite exciting to have that opportunity of vets coming in so that you don't have to go anywhere to get that extra education. Is quite cool. So we've talked about the veterinary side of things. And what about the research side of things? Does your rescue center do any research, or the organization in general, not just the rescue center?
Yeah, so the Olive Ridley Project is kind of expanding quite a lot into various different parts of sea turtle conservation, so we can kind of provide a much better picture of the conservation status here, specifically in the Indian Ocean. So not only do we kind of work here around the Maldives, but we also work in Seychelles, Pakistan, Oman, and Kenya as well, to be collecting data from as far and wide as possible. We do, for example, we run a sea turtle identification database here in the Maldives. It's the largest database in the country. We have over 5,000 individual sightings of hawksbills and greens, and so that's obviously to try and establish a baseline population data here, because the Maldives has historically been relatively there's a paucity of data really on sea turtles in the country, so hopefully we're going to try and fill in those data gaps. We also have we're running a socio-economic study at the moment in the Maldives to try and establish a baseline value of sea turtles, really to work out how much they're worth to, for example, the country or the tourism industry, or in order to try and improve the sort of status of turtles across the country. So that's we also then we research into things like parasites. So we collect parasites or anything from our turtles. So if there's any sort of leeches, barnacles, marine life, then we are also researching those and trying to establish a kind of idea of what's on what species. Because of course, like you said before, Olive Ridleys don't necessarily form a massive part of most rescue centres' caseload. They're quite uncommon. So we're quite lucky to have almost exclusively Olive Ridleys, which gives us a really interesting kind of population to study. So that's really important as well. And we do also obviously work within reproductive biology as well. So nesting, hatching, the Maldives is quite an important nesting site for green turtles. So trying to establish important areas that they are around, so that we can protect, help the government decide where best to protect, where we otherwise don't have any information about. We know they're here and that they're doing a lot, but we don't know
whatever you
quite
study. Sorry.
Yeah, sorry.
So basically, wherever you're studying in regards to the wild population, then you can work with the government to try to come up with new legislation that would protect them in the future. It's quite...
Yeah, exactly. We do try and work on kind of like a policy level as well to help inform policy making. And so we've helped, we work closely with the Environmental Protection Agency here in the Maldives to help them establish management plans for sea turtles, and generally just making sure we can kind of improve the status of them across the country. So we work, predominantly here in the Maldives, but like I said, we've got places elsewhere. We're also collecting this data and trying to establish baselines there as well, so we can do it sort of across the Indian Ocean and improve it for the whole Indian Ocean population, really. And beyond.
And then now you're also an affiliated rescue center of STRA. So then the idea is also that you start helping out sea turtles around the world in terms of the veterinary care that they might need as well, which is great. And thank you for that. So I guess we've talked about the veterinary care, the research. So kind of coming all together, then what are the main goals for the Olive Ridley Project?
So we kind of our sort of broad is, we would sort of say, we aim to protect and preserve the habitats of sea turtles here in the Indian Ocean, through outreach and education, through rescue and rehab, and through basically it's a very holistic approach, trying to provide veterinary care, of course, but also establishing a much sort of more secure habitat protection and that sort of stuff across like a policy level, as well as across the Indian Ocean, really. So we also, I probably should mention, we obviously ghost gear, which I said before, it was kind of how we started. So that's something also we do a lot of research into, is ghost gear in the Indian Ocean. So we initially were trying to work out where it was coming from, because it was washing into the Maldives so much. So that was a big part of our initial research goals. And now that we've worked quite a lot in that, we also then wanted to go one step further and work out how we can help sort of end of life recycling of fish nets in order to prevent it entering the water in the first place. So we really just want to sort of as broadly but also as specifically as possible, act on all different areas that are threats to sea turtles. So ghost gear is kind of where we began, but obviously there are a multitude of different threats that we're all very aware of. So trying to improve basically all of those different elements to overall improve the status and the security of sea turtles.
And you've touched there on the part of education. Does that mean that you do any lectures there, or you go, to schools, anything like that? How does that work a little bit?
Yeah, so we do quite a lot of outreach and education like that. So obviously the rescue centre being here on site is quite it's still quite it's quite well known. I think we're sort of generally getting better and better sort of established here in the Maldives. A lot of people know about our work now, and we do get a lot of schools who want to come and visit. A lot of people, of course, won't have seen sea turtles maybe that close up, or they sort of obviously aren't aware of the things that you can do, and even stuff like, you know, telling or showing people and establishing that sea turtles very much have their own personalities and an own individual, you know, they're just very individual. So it's nice to be able to bring kids in. We do a lot of school visits. We do festivals as well. So trying to just educate the next generation, I guess, of Maldivians. But we have a lot of great Maldivians working on our team who are responsible for that kind of outreach and education. So we always have an intern who works here on site who's from the Maldives. So they will really help us increase that local capacity, because of course it's really important that that's coming from home. So they we love to do, I guess, as many sort of things physically, but also of course digitally. We do talks to everyone from vet students to you know, to members of the general public. And of course, as well, probably things that I'm not even involved in, lots of very important conferences and things that I'm just here on the ground trying to fix turtles at the moment. So we do try and sort of get out there as much as possible, and especially as the rescue centre, I think the most important thing that we kind of do on the ground is showing people the work that we do physically, so guests can come around and see the rescue centre. We're a fully functioning hospital. You know, the turtles are always the priority, so guests can see us working. We're obviously always busy moving around, doing patient medication, patient therapeutics, doing bandage changes, and guests are always actually there sort of kind of watching in, and they always find it very interesting. And a lot of people take that home with them. They're more educated about the risks, they can modify their behavior, they can share that information, and they also obviously can donate. And all organizations, like all sort of STRA affiliated partners, mostly we're all charities, and so providing a source of awareness that people can then donate to our conservation charities, and then obviously help us do the work that we do.
Yeah, because I was going to run through that. Would be then what, with all that input that you're putting into the community, local and also global community, what are you then trying to expect them to come back as? Like what kind of, in what ways could they help you out? So we've discussed that, I guess, global community, yes, you want to, despite people maybe here in the UK, they don't see a sea turtle, but they're still aware of that they exist and what kind of problems they are facing and how can they change their behaviors even from a distance. But for example, in your local community there with the Maldivians, in what ways can they also be then involved in kind of getting back to the ocean, what the ocean is giving us?
Sure. Basically? I mean, obviously the Maldives is an incredibly biodiverse country when it comes to its marine life, and most Maldivians these days are incredibly passionate and aware of the sort of risks that that their animals face, and also as a country is threatened by all sorts of different climate issues which affect turtles as well. All of these things are kind of at the forefront of most Maldivians' minds. So having we really appreciate the fact that we have these guys on our team who can sort of share that information a bit more, because historically sea turtles, I guess, for example, here have been consumed, and obviously that's fairly common for most coastal communities in a sort of subsistence sense, but it's something that obviously these days is unadvisable in this area, at least because of the paucity of turtles to begin with. So a lot of this kind of, like, I guess, educating people about even things like how long they live, and how all of these sort of things that people aren't actually aware of about the sort of life cycle and biology of a turtle that impacts their ability to bounce back from these kinds of threats. That kind of awareness is definitely important and increasing, and people now are incredibly passionate about preserving their marine life for the sake of it, and also for other things that it impacts, such as obviously tourism and stuff like that, so impacting people's economy, livelihoods in the economy as well. So it's obviously very, very broad. But yeah, I think that's sort of just improving people's understanding of sea turtles. And there's a few common misconceptions about turtles here. We find quite a lot. A lot of people think that the turtles come back to raise their young, and they're very adamant that that's true. And of course we know that's not the case. But
poor
that
mamas.
can be sometimes like just sort of increasing that kind of awareness and sort of explaining obviously, and that helps, I guess, impact their understanding of why it's such a threat to maybe remove baby sea turtles from the beach, or to sometimes we see people retain them after hatching, or keep them as pets, or all these kind of things. So just helping to kind of break some of these old habits in order to improve the overall chances of survival, I guess.
And I guess you start getting more calls about sea turtles in distress if people do care about them as well. So that's also kind of works at your advantage in a way as well.
Yeah, definitely.
That's great. Yeah. So I guess going back to the cases that you see there at the rescue center, would you be able to tell us like one of your most successful or interesting cases that you've dealt with so far?
I always think of one particular case of a hawksbill that we had. So yeah, like I said, we see a lot of Olive Ridleys mainly, but I have a special place in my heart for the hawksbill. And we did have a very large adult male hawksbill who was found floating. His name was Harry, and he was found floating by a resort. And he, I guess, obviously being an adult male of a critically endangered species, that's always kind of an extra sort of layer of importance from a population perspective. Like, we don't see many adult males around the Maldives. The Maldives is generally a foraging ground for juveniles, so we don't see all that many adults compared to the youngsters. So it was extra sort of special to see him pop up. And he was very debilitated. Of course, we do have a sort of there's only a certain amount of diagnostics we can do, despite as well equipped as we are. We don't, for example, have like a blood machine or certain things that may help, just slightly more in these sort of kind of slightly unknown cases. So he was just floating, he was not eating, he was not responsive, but physically otherwise quite well, x-rays normal, all of these kind of things. But I think why he was so satisfying is because it was just kind of a case of supportive care and presumptive diagnosis, working off the like most likely scenario after excluding everything else. And this, like I said about hawksbills, we find a lot that we suspect may have eaten something toxic. So he had seemingly quite poor liver function, which I determined by him taking a very long time to wake up from a propofol anesthetic. I was breathing for him for like 18 hours. Wow. So he had a very, very delayed sort of recovery. So thinking things weren't quite working the way they should. But I inserted a feeding tube into him, and we just gave him, turtles take a lot of time. We all know they take quite a lot of time to do things. And I think it was quite satisfying just because it was a case of just, doing everything that we could, the feeding tubes, the supportive care, the regular blood sampling, barium studies, all these kind of things to rule out lots of stuff. And then just actually being like, okay, well, we will give you nutrition, we will give you sort of gut protectants and liver support, and we will give you as much time as you need to recover. And eventually he did recover whatever he'd eaten, or I don't know quite, but after about 3 months and like 8 weeks with a feeding tube in, he did eventually go back to normal. And so we were able to release him, and he was completely fine. And obviously, don't necessarily, it's frustrating not to get to the bottom. Obviously, as a vet, we love to know exactly, but sometimes they do just need a bit of help, and hopefully he's out there making a lot of babies. I can only hope, but I always think of him.
It's quite nice, because I guess, how long in maximum have you been able to see? How long does these do? Obviously depends on what kind of injury came in or illness did they came in the first time. I guess, what's the lengthiest that you've had a turtle in for rehab, if that makes sense?
I think because of the population we see, which Olive Ridley's entangled, and like I said before, they are quite prone to buoyancy problems. We think mainly due to the tearing of their lungs. So they almost always seem to get buoyancy issues as a result of a pneumocele, which we assume, although obviously we're not quite sure of the etiology specifically in these cases, but as a result of lung tears, probably due to trauma or overexertion or something like this. So we see a lot of turtles with buoyancy problems as a result of that. A lot of Olive Ridley specifically. So we have had a turtle, our longest patient prior to release was here for 2 years, 8 months and 11 days. And that was all because of buoyancy issues. She was fully healed up in every other regard, an excellent swimmer, but just had prolonged issues to do with buoyancy. And of course, if they're floating for a while, they develop behavioral issues that preclude them then diving, or sort of lung volume distribution issues, all of these things that are quite difficult to overcome. So she had an intense management plan of things like weight therapy and having to dive for food on a weighted buoy, going out for, we took her out for sea swims. We physically took her to the open ocean so that she could go and practice. And all of these things together, it took a long time, but eventually, just shy of 3 years, she was able to go. So that's obviously a bit of an outlier. Most of our patients are generally, the average time is 3 to 4 months.
Okay, yeah, because we have to remember they're obviously reptiles. They're going to take a while to heal, just so that we don't give up on them too soon and give them enough time. But just out of personal curiosity, when you take them for a sea swim, how do you keep a track that they're not gonna, like, do you have a lead on them? You don't have a lead on them. Or,
no, I don't actually. No, it's a totally fair question. It's obviously not something that all other rescue centres will do because we're in a lagoon. Being in the Maldives, obviously it's an atoll-based country, so we're in a lagoon, a sheltered area. So actually, we don't have any sort of extreme currents or too much extreme weather, which kind of gives us the opportunity to use the open ocean as their sort of recovery space. So certainly not that something that all rescue centres could do, but just our location serves us quite well. But no, we don't leash them or anything. I did try that once, but they wouldn't move. We pretty much it gets to a point where you know the turtle quite well. You can sort of establish their sort of rough kind of activity levels or how they might interact with things. And initially we make sure the visibility is good, the current's not too strong, make sure it's like relatively calm conditions, which it often is, and then we just let it go. If we sort of just hang behind them, 5 to 10 meters behind, so as not to interfere with them or stress them out too much. And if they are, in some cases it's been, we actually let them go and they are absolutely fine, in which case we can just sort of just release them straight away. Otherwise we will eventually go up, and once usually obviously I use taking out the turtles that don't swim that well or have obviously diving issues, so we can actually just go up, swim up behind it, and then push it back to shore. So it's not for every turtle, because obviously any kind of handling is stressful, and we have to weigh up the stress of potential transport and handling versus the benefits of being out in the water. But we do find for a lot of our patients that it is really beneficial, because the tanks we have are great. We have really deep tanks. We've got 2 meter deep tanks, and they're pretty large, so we do have a lot of opportunity to fix them just in the tank environment, but there are obviously limitations to turtles in tanks. So for a select few, they really just need the motivation of being out there to regain their buoyancy control or sort of put that effort in to do it. So
I guess it does help that your sea turtles are slightly smaller than bigger species.
I think that's
like
probably important
leatherbacks.
to mention. This would not be possible for most other species, but considering we're working with the smallest of the sea turtle species, that's another good point. We would not be swimming. I have a general max, like I won't probably swim things that are more than maybe 25 to 30 kilos, because it does become harder to manage them. But most of our Olive Ridleys are generally around about the 25 kilo mark. So yeah, we're dealing with a much smaller population than other rescue centres would be.
So like, I guess to finalize, I guess it's hard to choose one possibly, but what is your favorite fact about sea turtles? What are you so drawn out to work with them?
I think sea turtles, I love the fact that they have been doing this for so many millions of years in such an unchanged form. They have really been, they are properly dinosaurs in that sense. They've been around for that long. In fact, they can survive when dinosaurs couldn't. So that's quite a claim to fame. And I think they just have been doing this so incredibly well and well adapted to their environment. And I also think from a veterinary perspective, I just love the way like reptiles can heal from so much. They get put through a lot with the ones that we see. They are coming out with full bone exposure, like 80% of their humerus exposed, bits hanging off them. But if you give them the right support and manage the wounds, manage infection, they can almost always heal from it if everything else is kind of controlled. And I find that amazing. I think I've forgotten now how mammals work. I think mammals are just weak. They cannot cut it like sea turtles can.
Don't even go to birds then.
Don't even worry about them. But sea turtles are they're incredible. Like they're so resilient. And I think it's just amazing that they are continuing. The way they can continue on. And I think they're just they're really, really special patients.
That's great. Well, thank you so much today for taking the time to be able to present to us Olive Ridley Project and your work there. I know that you're coming up to finishing your term there. It's quite sad.
Sadly, I will be leaving Olive Ridley Project for now. Yes, I'll be moving away from the Maldives, but certainly we'll be keeping with obviously abreast of all of this. Not going to move out sea turtles anytime soon.
Yeah, I guess once you get hooked up, you don't. Well, not a pun intended, but
yeah, exactly.
Well, thank you again so much for having the time to join us. I'll let you know when the interview is out, and we'll keep in touch.
Thank you so much. Thanks, everyone.
Bye.
Bye.